Hi, my name is Lorna Muthania Ochido, and I'm making it one of my life's mission to demystify the speech therapy field and to empower more parents on what they can start to do in order to optimize their child's communication outcomes. So whether you want your child to talk more or talk better, learn better, and overall optimize their potential. So stay tuned and feel free to send in any topics on speech and language development you'd like for me to tackle. Welcome to today's series of What Is series, and today's topic that I'm tackling is what is a hearing test and what are the different hearing tests that your child can be recommended for your child to get done. I will tackle what you need to know about, some of what you need to know about hearing tests, but I must start by saying that most parents I have encountered at my clinic seem unsure about the necessity of having their child's hearing tested. And I will usually recommend a hearing test if I encounter a child with delayed speech and or language skills, as first, it is best practice to check the status of your child's or a child's hearing, particularly if they are delayed in talking or they are not pronouncing words clearly. And secondly, hearing is one of the prerequisites to normal language, speech and language development. So if I don't recommend a hearing test, I'll be negligent of my duties as a speech therapist, and because it is a well-documented fact that even a slight hearing loss or fluctuating hearing loss or hearing status can have a dramatic impact on language learning. So after offering this clarification, the follow-on question is usually something of a remark that, oh, my child can hear everything. To which I respond, I am not suspecting that your child doesn't hear completely, but we are exploring whether they are getting a clear enough sound signal going through their ears, that they are able to perceive sounds at different frequencies optimally, and that they do not have fluid trapped in their middle ear, as is usually the case with a lot of children, a lot of young children. So in case you're interested in learning some fascinating facts about fluid in the ear, or perhaps your child does have fluid in the ears, and how most children are susceptible to getting fluid in the ears, then please check out our other series in the same series, and the titled Fluid in the Ears or something of that sort. So let me state some facts about hearing. So fact number one. The professional that assesses hearing is called an audiologist. So your child's doctor or ENT does not evaluate, and I'll repeat, does not evaluate your child's hearing. Rather, the light they may shine into your child's ear during a checkup is to look at the state of your child's ear canal or drum, or whether it is inflamed, or whether there's anything obstructing the pathway. This test is referred to as otoscopy, and it is not a test to determine if your child's hearing is optimal. Fact number two, when a speech therapist requests that you get your child's hearing tested, the suspicion for most of the cases isn't that your child is deaf, no, but rather a question of how well they are hearing and whether they may be experiencing any fluctuating hearing loss, which may be caused by buildup of fluid in the middle ear, as I mentioned before. Fact number three, even severely profound children can perceive sounds such as music, aeroplanes, loud explosions, and most at-home hearing tests may not actually be that reliable. So like going and banging sufurias behind the child or pots behind the child. Another thing to note, that if your child has a hearing loss, they may have their other senses quite acutely tuned, which could make up for the hearing loss. So they may be very quick with their eyes if you try to sneak up, on them to test whether they can hear you, etc. Fact number four, well, I think it's four. In order to accurately test your child's hearing, the audiologist must test the inner ear, which is where the hearing organ is housed, and the middle ear, as this is usually where any fluid may be trapped. So there are various tests that test these specific parts of the ear. We don't test the outer ear because it's obvious if it's open, yeah? The most popular middle ear test is called tympanometry, or very commonly referred to as the TIMP. And this test assesses the volume of the eardrum, which is an accurate measure of whether or not your child has fluid in the middle ear. The test is pretty simple and quick. It requires that your child remains very still for the duration of the time that it takes the audiologist to insert a probe into the ear of the child's ear. The ear of the child's ear. Into the child's ear. The probe is just like an ear thermometer or a cotton tip, but obviously bigger, and it has a machine attached to it. So the probe is inserted into the ear, not very far in, and then it remains there for about 20 or 30 seconds for the audiologist to get a reading. The reading is in the form of a graph, which is, if there's no fluid, should have a nice peak. But if there was fluid, there will be no peak, and it will be instead referred to as a flat tympanogram or a type C tympanogram. So what is ideal is a type A, where there's a peak. There are various tests for assessing the inner ear. Yeah, so we have behavioral tests, which are the gold standard of hearing tests. So one behavioral test is referred to as the pure tone audiometry, or PTA, which stands for, as I said, pure tone audiometry. It is also called air conduction testing, since the sounds go through the outer and the middle ear. And this test helps find the quietest sound that your child can hear at different pitches or different frequencies. The audiologist can either put earphones on in order for the sounds to go to one ear at a time, or the sounds can be administered free field, meaning the sound is just administered in the sound booth, the soundproof booth, and the audiologist looks for a reaction from the child that they heard the sound. With free field though, you might then not be able to determine which ear. If there's a very slight hearing loss in one ear, then you're not able to determine which ear has a hearing loss. The audiologist will then record your child's hearing results on a graph called an audiogram. So we'll chart, what pitches, what frequencies the child hear, what loudness. Then there's play audiometry, which is very similar to pure tone. It's also a type of behavioral test, but the child has to be really conditioned, and it can also be used on a little baby. So the way you would know that a child has heard is that when the sound is administered, just free feel, the child then looks at a booth, then lights up with a puppet or whatever for very small babies. For other ones, it could be a pegboard, and then each time they hear a sound, they put a peg in. So just to make it fun, so it's referred to as play audiometry. Then we have tests that are not behavioral based, like ABR, which stands for Automated Brainstem Response Test, which tells us how the inner ear, called the cochlea, and the brain pathways for hearing are working. So the test is used with children or others who cannot complete a typical hearing screening. The ABR can also be recommended if your child's symptoms might be due to hearing loss in the brain or in the brain pathway. So there's a condition called auditory neuropathy, where usually what would cause a hearing loss, which is as a result of the inner ear not functioning properly, will be the loss of hair cells that are contained in the cochlea, the hearing organ. But in the case of auditory neuropathy, the hair cells within the cochlea are actually present and functional, but the sound information is not faithfully being transmitted to the auditory nerve properly. So every organ, just a little biology recap, every organ in the body or every motor action or muscle action has to be communicated to the brain through nerves in order for that function to be properly executed. So an ABR would also be used to ascertain that the nerve that communicates sound to the brain, which is referred to as the auditory nerve, is working properly. ABR tests are also used when a child is being assessed for eligibility to have a cochlear implant, as if the nerve is not communicating between the cochlea and the brain, then even with a cochlear implant, that child will not be able to hear if there is nerve damage or auditory neuropathy. So very important reason for doing an ABR. I really hope I'm being clear, because it sounds a bit technical. So please feel free to let me know in the comments. Also feel free to pause, rewind as many times if all this doesn't immediately make sense. And then another test that is basically brain evoked is the ASSR, which stands for Auditory Steady State Response. And this can be thought of as an electrophysiologic response to rapid auditory stimuli. The goal of ASSR is to create an estimated audiogram, just like the PTA, to benefit the accurate management of the child's hearing or hearing loss. So ABR and ASSR are similar in the sense that for both the tests, the child is usually resting or asleep, and electrodes are attached to the child's forehead, which record bioelectric or auditory evoked potentials that tell us whether or not a child is hearing. But the main and most important difference between ASSR and ABR, or rather the advantage that ASSR has over ABR, is that ASSR tests they allow for the generation of statistically valid audiograms similar to one generated through behavioral tests such as PTA, whereas ABRs don't. ABRs just tell us the child hears or doesn't hear, but how well, maybe the degree of loss, yes, it will communicate, but not the frequencies. So the importance of this distinction is that the audiologist is able to identify the child's hearing status across all the frequencies. We detect different sounds at different frequencies, which for me as a speech therapist is critical, as a hearing loss across a particular frequency will have implications on whether a certain sound will be easy or hard or difficult for the child to perceive. So having results of the child's hearing across all the key frequencies will also aid in the right selection and programming of hearing devices, which in turn will give us the best programmed device and the best possible chance of great speech therapy outcomes for the child. So very important. If you must do one of the automated responses, brainstem responses, ASSR gives us a much better indication of the child's hearing status. I do feel that this topic was rather technical. I honestly hope that this series has provided useful information and not just more jargon to leave you confused. I have to also just add that ABR tests and ASSR tests are much more expensive here in Kenya. So an ABR, a PTA, the behavioral test, will cost a fraction. ABR, ASSR can cost up to 3 times more. And for me, I prefer results from a PTA because they give us a very good indication of how your child is hearing across the frequencies. We know they're already hearing usually, generally. So an ABR, if a child is able to be conditioned, is, in my opinion, this is now where I say it's opinion, not fact, is unnecessary. But if a child has behavioral issues or can't be conditioned to be able to complete a PTA, then yes, an ABR or an SSR preferably. I will hope to include more distinctions in the blog post that will accompany this video, and if need be, and actually I might just consider another topic which will cover types of hearing losses. That will be available and communicated when that comes available. So don't forget, you can also check out the topic of fluid in the ears in the same What Is series as this particular topic. And thank you so much, as always, for tuning in. Please check out some of our other resources to learn more about any of the new topics that this series has raised for you. Thank you.